joining us live in the studio today is Dr. Daniel Mwai. He's a health economist and also presidential advisor.
And he's Daktari, by the way. He's doctor. He holds a PhD in health economics.
Look at that.
Under the African Economic Research Consortium. Is that true?
Yes.
Yeah.
Daktari, karibu sana. NHIF.
Yes.
To
SHIF.
And SHA.
Confusion.
Bana
SHA,
Patel.
Nini, Mama Mboga huko amechanganyikiwa. What is
wataenda wapi?
Nini?
Daktari, break it down for us.
We are transitioning
tomorrow, October 1.
Yes.
Thank you very much for having me first.
Yes.
And I think we have a small confusion, as you have mentioned, and confusion is removed by pushing in the right information. So the transition is from National Health Insurance Fund, which is NHIF, to Social Health Authority, which is SHA. That is the transition. So it is the confusion is ideally because of people trying to explain what is inside SHA. So what is inside SHA is the whole of what NHIF was covering, is what is called SHIF. And then it has decided that we need to also help our Kenyans to actually access services within lower level facilities, that is level 2 and 3. This is dispensary and health center. That money will come from a fund called primary health care, because those are the primary health care facilities. They are closer to the people. That's why they are called primary. They are your first contact. It's where you rush in case umepata mambo ya dharura. It's very close to the people. And then, of course, there is the last one, which is emergency and chronic illness fund, which is the third one, which is ideally taking care of the emergency component, and is a pot where if you have faced huge catastrophic spending, that means is what you are saying, that majority, almost a million of Kenyans usually go to impoverishment or poverty each year on account of health expenditure. So that is a fund that is also leveraging, so that we try and reduce that number, because the more you save, the less of investment you do as a country.
Kwa hiyo hakuna kubadilika mambo mob. Itakuwa what we were getting under NHIF will still be available, but under the new authority, and all these other levels of healthcare will be taken care of under the Social Health Authority.
So we begin by looking at what is the biggest problem we are trying to solve. Is that Kenyans do not go to hospital in facilities that are closer to them. So they bypass those facilities. They go far. One of the key reasons is because NHIF has only been paying for facilities at a higher level. Level 4, 5, and 6. Sub-county, county hospital, Lifaro. Therefore, if I'm a household and I'm even having a flu, I would have been treated with within my dispensary. And when I grew up in Nyahururu, I used to go to a dispensary for the longest time, I know. But if, because you're not purchasing services from there, then I go up where the services are more expensive, I need more experienced people, but the disease does not require that kind of treatment. So we misuse our resources that way. Now, the key reason then why the primary healthcare fund came is so that the Social Health Authority is able to purchase services from lower level facilities, just as it does in higher level facilities. Because it doesn't make sense that you only pay when I go to an expensive hospital, but when I go to a hospital that is closer to me, which is actually our local hospital, then that hospital, one, does not get the money because I will not go, and two, you refuse to pay just because I have gone to a hospital that is at lower level facility. So it is very important to know why the primary healthcare fund was added to what used to actually be the NHIF. Because NHIF used to come up to around level 4. But now coming down to level 2 and 3, which is our ideally primary facility. It is your local dispensary, it is your local health center.
Clinic.
So, correct. So when you go there now, you still go with your ID. And you'll give your details, will be identified biometrically, and the services you get will not be charged. But the facility will be paid for that service they have provided to you.
Okay. My friend Igunze and I, what do we do if we're NHIF up until today, September 30th? Do we have to re-register again tomorrow for SHA?
So there are two things. You will have to consent that for the movement of your data. But I want to highlight two things. Number one, NHIF has lost billions of shillings.
Billions.
And this,
And you see they are wrapping up today.
You have reported more than 1 million times on this problem.
Last year alone, 20 billion.
The biggest problem why this is lost one is because we don't have a single source of truth. How do we identify Jeff is Jeff? So you have Jeff Igunza in Jeff. This is what I mean. That the NHIF corrected people's biometric. And in correcting those biometric, they were not clean. So what happened in many instances, you'll find that your hands, for instance, you have 10 fingers. But what the NHIF has could be 7. Yours, Jeff. And then the 3 belongs to him. Now, what he can do in the morning, on Monday, he can admit you in a hospital somewhere. When you're still on air here, then wait for around 4 or 5 days, then discharge you and charge NHIF.
And get paid.
And get paid, of course.
As a facility now.
The people who, for you to steal money for NHIF, you need to be a facility.
Because NHIF pays to facility.
Correct. Now, what are we saying? We are first saying that we must establish a single source of truth. To begin with, we are not correcting any biometric. So when you place your finger on the biometric leader, it will lead the NRB results, the fingers you registered with.
Right.
Now, when you are registering for either passport or even for the national ID, ideally, you give all your biometric. Now, this other attempt to collect other biometric, of course, brings a lot of dirty data into the system. After also receiving feedback on this, what came was we clean the fingers, but when you go to where you are receiving the service, you can verify because the fingerprints are there. It's just verification of your biometric. You can wait to get sick, you do it, or you can do it early if you just want to be ready. Anybody earning low pays a bigger proportion by those earning higher. Now, you lack equity and you lack fairness. And what did that is the law we created. But who created? The people who created are people who are earning high incomes. Because the poor never. Also, the SHA will collect extremely little extra money. The only thing that have happened there is everybody pay the same. That is the main thing.
Which is what?
2.75.
Everybody.
Everybody. Whether you are a poor, low income earner, middle, high income. All right? You contribute the same. Because if you are quiet when the poor were being charged 5%, and it has been cut to actually 2.75, it actually very unequal for us to propel any narrative. And let me tell you, when we list our numbers, we start from 20%, 20,000, we say 550, and I've seen them on TV this morning. And we go all the way to 10 million.